Hey everybody, do you have treatment-resistant depressive symptoms? Maybe you feel a little bit better after medication and therapy, but continue to struggle with distractibility, feeling scattered, or struggle with following through with important tasks. If so, you might have underlying ADHD, which can impact your response to treatment. So up next, the three of us are going to discuss the relationship between ADHD and depression and how the two impact one another. So stick around.
Hi everyone, welcome to Real Talk Mental Health, where we talk about real life mental health issues from the provider's perspective. That's us. I'm Julia Swafford. This is Brendan Rowe and Piper Bursmeyer. We are psychiatric nurse practitioners and the founders and co-owners of TMS Northwest. The three of us feel passionately about diagnosing and treating ADHD because we understand the impacts of unmanaged ADHD and have seen firsthand the life-changing impact of actually treating it. At TMS Northwest, we've seen this concept on steroids because we see clients that have been depressed with unmanaged ADHD upwards of 20 to 30 years. We've come to a deeper understanding of the severe impacts that unmanaged ADHD can have on depression. We already know that by the time you get to your fourth or fifth antidepressant, chances of remission are very low. So why do prescribers keep going with antidepressants rather than looking for underlying issues or referring to other treatments? Let's take a step back. We understand that providers mean well, but some things just keep getting missed. We want to lay it out for you from our perspective about how depression and ADHD can overlap and how ADHD can be missed and actually lead to worse outcomes and other diagnoses. Piper, you did a lot of research in your thesis about how ADHD and depression can overlap. Do you want to share some of your insights on that?
Yeah, absolutely. So my thesis was in self-concept in ADHD, and I think that the important piece here is understanding how depression and ADHD can look a lot alike. But in particular, when I review self-concept, what I really mean by that is, self-concept is the cognitive image of yourself, the belief of who you are and your what you stand for, your values, and really your attitudes about yourself. And how that presents in ADHD people is, who am I? And, am I loved? And am I good enough? And that is something that can play in their minds frequently. And so does it impact mood? Absolutely. But it is absolutely different than depression. So, I think that in depression, we see dark sadness, deep sadness. And it's not that ADHD people can't feel sad, but this self-concept issue is significant because when they're questioning what they believe in and who they are, and this is pervasive every day, this is really challenging. And what we found in my research in graduate school 12 years ago, a long time ago, we found that self-concept was actually worse the older you got, and that was kind of correlated, and you could perhaps connect the dots that the longer ADHD goes unmanaged, the worse self-concept gets. We understand that unmanaged ADHD puts us at risk for depression, but really talking about self-concept is super important. So I think that in depression, we're typically focusing on hopelessness and suicidality. It's a risk factor we pay a lot of attention to, but self-concept and poor self-concept creates a lot of suffering, and it's sometimes just as taxing as suicidality. But we don't always ask those questions on whether that person's questioning who they are or their belief system. I mean, I don't know when I first was in practice, I asked a lot of those questions. So I think that the problem with self-concept is it tends to define you. In depressive symptoms, they can come and go and you can get some relief from it. So another concept that we have in the correlation between depression and ADHD is that we start to notice situations with suicidality and low self-esteem. And really, furthermore, low self-esteem is something we assess a lot in depression and suicidality, but in ADHD it presents as something called rejection sensitivity dysphoria. RSD is what I'm gonna use the verbiage. And what it is it's basically a very extreme reaction to feelings of rejection, and these reactions can be behavioral in nature, rage, it can be verbal fights. This is hard because when an ADHD person feels criticized by someone especially important in their life, it can be almost life-ending, it feels like. Now, why this occurs is the ADHD brain processes information differently and also takes in information differently than the typical brain does. And so when it takes in information, it takes it in incorrectly a lot of the time. So whether it's distractibility or poor listening, or they can't read body language as well, or multitask, they're taking in information incorrectly. And then when they're processing it, they tend to attach really intense, dramatic emotions associated with the event. And the more that you tell that person that's not how it happened, the more reactive they get, because that's their reality.
That's the way they're interpreting it.
Yes. And then when you say things like you're over the top and why are you acting so crazy, then that feeds into the rejection of I'm not loved, no one hears me, no one listens to me, I have no place in this world. And that's where we keep going back between the depressive symptoms and the rejection sensitivity dysphoria. And it can be very extreme in some cases. Now, what we also see is that, we see this extreme sadness and tearfulness in depression, but it doesn't mean that doesn't present in ADHD. And in fact, the chances of depression are very high in ADHD. And Julia, I think it's important to talk more about, something we also assess in depression is motivation.
Yeah.
And how that looks different.
I see with the motivation piece coming up a lot, especially recently in this whole last year. A lot of my clients, no matter what they're diagnosed with, are complaining of low motivation. And the question I've been asking lately especially is, okay, where is that coming from? Is that coming from a place of, total disinterest, what we call anhedonia in depression, that social withdrawal, just wanting to be alone, versus in ADHD that might actually come from disorganization, complete overwhelm by tasks, and just not knowing really where to start. But I just think that's a pretty cool difference, at least in my perspective, when I've been assessing people, that has come up a lot.
And that we hear about just being paralyzed. ADHD clients of ours may want to do things and actually have the motivation. They just don't know what to do, and so they just avoid, and they do everything easy instead of challenging. Yeah, we see that a lot.
Yeah.
Kind of the least common denominator, right? So, when we talk about the overlap with depression and ADHD, this is not the only thing that's overlapping. And in fact, there's quite a few other topics. And Brendan wants to talk about social anxiety and ADHD.
So absolutely, kids with untreated ADHD are frequently criticized by their parents, their teachers, their siblings, even their friends. So negative messages like you're talking too much, you're too loud, wait your turn, stop being annoying, you could do so much better if you just applied yourself. Well, over time, that cumulative effect can lead to fear of being judged or evaluated by others, which is the hallmark of social anxiety disorder. So, also people with ADHD struggle to focus in conversations, especially in a group setting, when, which can contribute to feeling overwhelmed or, by lots of noise, or overstimulated by a crowded place. So feeling easily distracted can contribute to missing chunks of a conversation, even when someone's talking directly to you. So over the years, I've noticed that social anxiety sometimes resolves on its own if I manage ADHD well in my client.
Yeah, actually, I recently had a client who told me that his social anxiety disorder that we were treating was totally resolved, but only after we resolved the ADHD. We're treating the ADHD. That was really cool to see.
That's awesome. So also ADHD can have overlapping symptoms with bipolar disorder too. So impulsivity, increased talkativeness, trouble sleeping, restlessness, a poor social filter. They might have a poor frustration tolerance, which can lead to difficulty taking a pause between feeling frustrated and acting on that emotion. So like Piper was saying, there can be a roller coaster ride of emotion that happens throughout a single day as a reaction to stress rather than an episode of mood changes like we see in bipolar disorder.
Yeah, for sure. And then, these huge meltdowns kind of, in ADHD can mimic mania. And they're truly related to rejection sensitivity dysphoria. And that because providers are more comfortable treating bipolar than they are ADHD, often ADHD treatment gets missed and gets avoided. And, frankly, it's the over-exaggerated, fear that providers have of destabilizing bipolar people, which leads to them continuing to increase their mood stabilizers and antipsychotics, which have significant side effects, including weight gain, and that they're not getting to the core of the problem. And that's a huge concern. And so we forget that ADHD and bipolar can occur together and frequently do, and it's really important to treat it. And that frankly, many of the bipolar symptoms can resolve and stabilize when ADHD is well managed.
Yeah, absolutely. So, okay, so one other problem that tends to converge with ADHD is a risk of substance abuse. So often, people who fall into substance abuse problems who also have ADHD begin to try and self-medicate their underlying impulsivity.
With the drugs.
Yeah, which can, lead to a failure to consider the consequences to your actions. So, interestingly, research actually shows that kids who have their ADHD treated, are far less likely to have substance use disorders as an adult.
Yeah, impulsivity is managed.
Yeah, I love that research. Well, let's finish our conversation by talking a little bit about the treatment implications of the stuff we've been talking about. I've found, three kind of main points. So first, as we've been discussing, but just to reiterate, if you do have ADHD in addition to another condition, there will be symptoms of the ADHD that we just can't get to by treating only the depression or the anxiety or whatever we're talking about. So that's point number one, or whatever condition you have. So that's point number one. If you've had partial treatment results from that treatment, but some symptoms are still interfering with your life, that could be ADHD. And the reverse is true. Untreated ADHD can make symptoms of other conditions worse.
Absolutely. The longer ADHD goes untreated over a prolonged period of time, it creates an influx of stress hormones that can lead to the onset of worsening clinical depression.
Right. Okay, so another point about the treatment is that sometimes once depression or another condition is managed, ADHD symptoms may become more obvious when they weren't noticed before, especially when a person has a debilitating anxiety or depressive disorder to the point that they're basically in survival mode, day to day, and they're totally unstable. So once those symptoms are treated, or during that time, the ADHD symptoms might not even be on their radar. So once that's treated,
they
then
can't even get out of bed.
Right. So once that's treated, then and they're stabilized, we can more see the impacts on their functioning. Okay, so one last point. If a person is just starting treatment and it seems that they might be suffering from both ADHD and another thing like depression, it might make sense to treat the ADHD first to clear it out and then reassess remaining symptoms once that's taken care of. I've experienced so many times that the patient might not even have clinically relevant anxiety or depression once the ADHD is treated. ADHD is easy and straightforward to manage, and rates of success with treatment are very high, much higher than for depression or even conditions like high blood pressure.
I think that, stimulants are some of the most well-studied medications on the market. I mean, we have data since the 40s. I mean, there's really no arguing the data. That's, I think, why we're so passionate is we see it in our office, but we know what the data says too. I think the big takeaway here is that ADHD is super deep and complex, and it deserves as much attention, if not more, than other diagnoses, because we need to take the time to assess for it, tease it out. Sometimes it's hidden, especially in females in particular. And Julia made a really great point. When you clear out ADHD, you really get to the core of the problem, and people end up on less medication, frankly. And that's the goal of both providers and patients in a lot of ways. And so, we understand that we must take ADHD seriously because the consequences of not treating it are just so significant. And just frankly, it's unnecessary suffering for patients. They deserve the treatment.
So, well, I think that wraps up the discussion, and we love this stuff. I think you can tell we have passion for this subject. So, thanks for listening, for engaging, and we'll see you next time.
Sounds good, guys.